This is a quality safety dashboard presentation about pain presented to you by the following College of Nursing students: Glory Nmeribe, Valentine Okoye, Summer Odell, Randall Osborne, Sophia Quick, and Megan Renfro.
Hello, my name is Valentine Okoye, and I'll be giving an overview of quality safety measures in organizations. Quality Dashboard is a workable web-based tool utilized by health facilities to monitor and evaluate performance of key indicators. It is used for quality reporting and population management integrated into the electronic health record. This tool allows managers to identify critical issues and allocate appropriate resources to key issues like cost, quality of care, and patient outcome. Quality indicators are standardized evidence-based measures of healthcare quality that can be used with readily available hospital inpatient and main data to measure and track clinical performance. For this study, we we will examine pain as a quality indicator. This project, we assume that each units have 35 patients. So for every shift and at every unit, it is expected that a target total of 35 pain level assessments are done. However, the data presented for this project shows that in the first quarter, the actual goal met was 25, 24 in the second quarter, 30 in the third quarter, and 24 and 28 in the fourth quarter. The data is evaluated at the organizational level, and the management decides on measures to take to make improvements. An electronic health record is used to collect data for quality dashboards.
All right, my name is Megan Renfro, and this is my part of the presentation. For this unit, we're assuming that it has 35 beds, so a total capacity of 35 patients. Because of this, the target for pain assessment was 35 in each quarter. In the first quarter, the actual was 25. In the second, it was 24. The third was 30, and the fourth was 28. Overall, this unit never met the target goal, but was always very close, being the closest in the third quarter. Pain is important to assess because uncontrolled pain can lead to serious psychological and physiological damage, including continuously elevated cortisol levels and inability to perform ADLs. Pain is also important to assess to evaluate whether or not interventions have worked. Assessments are often overlooked because nurses feel rushed or encounter communication barriers. The Joint Commission requires hospitals to assess pain as the fifth vital sign to receive accreditation. Over the years 2000 to 2002, the practice of assessing pain in a vital sign assessment was put into place in an effort to better diagnose, manage, and assess pain. Although this did positively impact pain assessments, it has also led to a large unintended consequence: overprescription of opioid medications. The Joint Commission efforts to draw attention to patient pain worked, but also revealed a severe deficit in pain management techniques. Doctors have begun prescribing opioids in an effort to address pain without first exploring non-pharmacological methods. Along this same vein, CMS, or the Centers for Medicare and Medicaid Services, send out surveys to patients of participating hospitals asking about their stay. This survey includes questions about quality of pain management, and the better the score, the larger the hospital reimbursement. In 2018, these questions were amended and shifted from how well the staff managed the pain to how often the staff managed the pain. This raises more concerns about whether or not CMS is incentivizing physicians to overprescribe opioids. Overall, pain is very important to address and manage, but extensive pain education for staff members, including how to implement non-pharmacological methods, is vital to improving patient pain management overall. This education could help units reach their target goals more frequently for pain assessment.
Hey, this is Summer Odell, and my slide is about investigating the problem. So we just wanted to talk about possible causes of why pain is not assessed in patients. One of those causes is forgotten priority, because pain is checked so often that sometimes nurses honestly forget due to non-routine pain assessment, inadequate physician-nurse interaction, absence of nonverbal pain assessment in the nursing flow chart, or lack of policies and guidelines. There's also organizational barriers that have to do with inadequate nurse to patient ratio and presence of less experienced personnel. There can also be attitudinal barriers that make this hard to do. So, like adequacy of sedatives, failure to understand the pain of an unconscious patient, or no belief in nonverbal pain assessment scales. And then there's barriers to knowledge, which is unfamiliarity with the use of nonverbal pain assessment scales, insufficient training for clinical use of pain assessment scales. Also, with pain, it's important to remember that it still needs to be assessed in patients with chronic pain, and the lack of patient participation can also be like a barrier or reason pain that is not assessed for certain clients.
My name is Sophia Quick, and I will be addressing the deficits of pain assessment. An intervention that should be used to increase the frequency of pain assessments in the clinical setting is by treating pain as a fifth vital sign. In a study by DeCastro et al., the nursing team of a cancer palliative care clinic tried implementing pain as a vital sign for 3 months using the numerical visual scale. The results showed that this intervention was difficult to implement in nurses' routines. 50% of the nurses attributed the main difficulty to an unavailability of time, and 25% reported a lack of knowledge on the subject. This study demonstrates a need for a better nurse-to-patient ratio to allow for decreased nurse stress and more time to provide this important aspect of care, in addition to the continuing education of nursing teams about the importance of pain assessment. One deficit to pain assessment is that it is difficult to assess pain in a patient who is nonverbal, unconscious, or cognitively impaired. In non-communicative individuals, pain cannot be articulated through a self-report, placing them at an increased risk for under-recognized and undertreated pain. One intervention that can be used for these patients is the FLAC pain scale. This scale assesses the presence of pain based on behavior for nonverbal clients. The instructions for using the FLAC pain scale are as follows. For patients who are awake, observe for at least 2 to 5 minutes. For patients who are asleep, observe for 5 minutes or longer. Observe the body and legs uncovered. Reposition the patient, if possible, to assess the body for tenseness and tone. If it is not possible to reposition, simply touch the body. Another pain scale that can be used is the behavioral pain scale. This pain scale is better suited for critically ill patients on ventilation. Similar to the FLAC scale, it assesses facial expression and upper limbs. In addition, it assesses the patient's compliance with ventilation, whether they are coughing but tolerating the ventilation, fighting the ventilation, or unable to control the ventilation. Another deficit is nursing knowledge of pain assessment and management. In a study by Marganeri et al., 20 nurses in a pediatric specialty hospital underwent a quality improvement initiative to implement an evidence-based pain education session. The nurses were educated about pain assessment, reassessment, management techniques, both pharmacological and non-pharmacological, how to provide pain education to patients and families, and why pain management is important. Upon assessing the effectiveness of the education session, the results showed that pain assessment frequency increased from 43% to 67%, and the use of a developmentally appropriate pain scale increased from 33% to 84% after the intervention. This shows that providing proper education on pain is essential for quality improvement of pain assessment. Another deficit could be nurses' attitudes and beliefs about pain and pain management. In a study by Issa et al., nurses were given a pre- and post-test using the Knowledge and Attitude Survey regarding pain tool, where they answered 22 true or false statements, answered multiple choice questions about pain, and answered questions based on case studies. The authors implemented a pain management education program using interactive workshops, in-service group discussions, and PowerPoint lectures. According to the post-test results, the program was found to be effective in shifting the nurses' attitudes to be more positive toward pain assessment and management. This demonstrates that nurses' attitudes and beliefs about pain are just as important as nurses' knowledge, and it is essential to use interventions that assess their attitudes regarding pain assessment and management.
Application to EHR client. There are many studies conducted with data pulled from within the EHR. Through various studies conducted, the Joint Commission revised and implemented new standards of assessment and management of pain. Per the Joint Commission, the program-tailored standards are designed to strengthen organizations' practices for pain assessment, treatment, education, and monitoring. Secondly, the EHR can be used to facilitate quality improvement in the care of patients' pain in regards to the data that reflects the assessment or lack of assessments being conducted during patient care and vital signs. According to another study conducted, the recurrence of clinically significant pain during the hospital stay probably reflects inadequate assessment and management of pain. Only 0.2% of pain assessments were made independently of vital signs, suggesting that coupling pain assessment to vital signs monitoring has not encouraged the timely reassessment of pain. Finally, the EHR should make the facilitating of the process much easier as a whole. Though there may be difficulties, according to a study which stated, it took approximately 4 to 5 hours on average to complete each patient's medical record review. The difficulty of locating appropriate data for each EBPM indicator contributed to the prolonged data abstraction process. Role of BSN nurse and leadership skills. The role of the BSN nurse in implementing change with the use of information technology can be performed in a variety of ways. The following are a few examples obtained during personal communication with Frida Osborne, RN, BSN. First, including pain assessment documentation of a patient as part of the orientation requirements of a new nurse upon hire into a new facility with a preceptor's signature required. Secondly, education of staff during monthly staff meetings to include the teaching of various pain skills and when to use them appropriately based on the type of patient treating. Thirdly, implementation of computer-based learning education to be completed during annual retraining for nurses. Finally, internal audits are done using the patient's electronic medical records to reflect administration of pain medication and the reassessment of pain levels within 0.5 to 1 hour of administering.
Everyone, my name is Nmeribe. I'll be talking on informatics and nursing. And in this section, I'll be addressing 4 important questions. And the first one is to discuss the role of informatics and the implication in patient care and outcome. With the prevalence of chronic diseases, informatics play a major role in patient-centered care by ensuring that patients receive digitalized vital guideline recommended care. It offers patient-related information and can provide support mechanism to patients. Informatics allows healthcare professionals through the EHR system to have access to patients' information worldwide. Informatics has played various roles in primary objective to enhance the healthcare system in the care of pain. The second question is, how can informatics be used? Informatics can be used through electronic health data to support integration of patient-reported data on pain. Informatics review, develop, and adapt policies and tools that can be easily shared and adopted in the services of supporting patient care among health professionals. How is data mining relevant to this topic? Data mining is relevant to pain as internet-based and mobile apps serve as databases to collect and store large volumes of information relating to pain, patient pain. It helps monitor and manage pain. It also helps to communicate plans on how pain can be properly managed in the healthcare system. Data mining is relevant because it helps to monitor, to manage, and communicate health-related information and plans on how pain can be managed. The fourth question is my recommendation for the use of informatics in the scenario of pain management. One, I would recommend that informatics should develop a standard way to track and take data on the successes of managing pain, and also interventions that were implemented in pain management but did not work out should also be recorded and as data and saved for future comparisons. And lastly, I recommend that there should be a standardized terminology for correspondence amongst healthcare professionals that would enable evaluation of clinical data generated by documentation in an electronic health record, especially with regards to pain. Thank you. Hello, everyone.
Hello, it's Valentine again, and I'm going to give a summary of the project so far. Performance measure is an effective way to evaluate the efforts by nurses in reaching the target goal for the quarter. Pain measurement is a quantitative indicator of the quality of care patients receive in the hospital setting. Some performance deficit include lack of time and knowledge by nurses and non-communicative patients. Now, it is important to observe for these deficits to see where the health facility is falling short and can make improvements. Practices such as FLACC pain scale and the behavioral pain scale have had a huge impact in managing the pain of patients. Knowledge and attitudes survey regarding pain and pain management education program have shown to improve hospitals' capacity to help better manage pain intensity. These tools have been invaluable at managing the pain of patients over the years. It's important we utilize these tools because pain not assessed may linger and cause a chronic stress reaction that leads to reduced ability to fight off illness. This increases the length of admission of patients and increased costs for the hospital. Thank you. Hello, it's Valentine again, and I'm going to give a summary of the project so far. Performance measure is an effective way to evaluate the efforts by nurses in reaching the target goal for the quarter. Pain measurement is a quantitative indicator of the quality of care patients receive in the hospital setting. Some performance deficits include lack of time and knowledge by nurses and non-communicative patients. Now, it is important to observe these deficits to see where the health facility is falling short and can make improvements. Practices such as FLACC pain scale and the behavioral pain scale have had a huge impact in managing the pain of patients. Knowledge and attitudes survey regarding pain and pain management education program have shown to improve hospitals' capacity to help better manage pain intensity. These tools have been invaluable at managing the pain of patients over the years. It's important we utilize these tools because pain not assessed may linger and cause a chronic stress reaction that leads to reduced ability to fight off illness. This increases the length of admission of patients and increased costs for the hospital. Thank you.
My name is Nmeribe. I'll be talking on informatics and nursing. And in this section, I'll be addressing 4 important questions. And the first one is to discuss the role of informatics and the implication in patient care and outcome. With the prevalence of chronic diseases, informatics play a major role in patient-centered care by ensuring that patients receive digitalized vital guideline recommended care. It offers patient-related information and can provide support mechanism to patients. Informatics allows healthcare professionals through the EHR system to have access to patients' information worldwide. Informatics has played various roles in primary objective to enhance the healthcare systems in the care of pain. The second question is, how can informatics be used? Informatics can be used through electronic health data to support integration of patient-reported data on pain. Informatics review, develop, and adapt policies and tools that can be easily shared and adopted in the services of supporting patient care among health professionals. How is data mining relevant to this topic? Data mining is relevant to pain as internet-based and mobile apps serve as databases to collect and store large volumes of information relating to patient pain. It helps monitor and manage pain. It also helps to communicate plans on how pain can be properly managed in the healthcare system. Data mining is relevant because it helps to monitor, to manage, and communicate health-related information and plans on how pain can be managed. The fourth question is my recommendation for the use of informatics in the scenario of pain management. One, I would recommend that informatics should develop a standard way to track and save data on the successes of managing pain, and also interventions that were implemented in pain management but did not work out should also be recorded and as data and saved for future comparisons. And lastly, I recommend that there should be a standardized terminology for correspondence amongst healthcare professionals that will enable evaluation of clinical data generated by documentation in an electronic health record, especially with regards to pain. Thank you.